Hi guys, this is Doc Chris, your online family doctor, making medicine easy for you to have a healthy life. Itong video na to ay nakatarget ako sa mga primary care physicians, family medicine residents, family medicine specialists, even syempre may co-doctors who are handling diabetes. Okay, if you're not yet fully aware, we have already the 2025 clinical practice guidelines for screening, diagnosing, and managing type 2 diabetes in the outpatient care setting. So again, punta lang muna ako dito. So this is the PDF. Pag-download mo siya sa Department of Health Compendium for Clinical Practice Guidelines. I will be focusing directly on page. Saan ba ako? Ngayon? Nandito sa page 42, 'di ba? Pero tignan natin yun. Ito yung first page. So this is the first page, Clinical Practice Guidelines for the Screening and Diagnosis of Outpatient Care Diabetes in the Philippines. This is part 2, and this has been participated by a lot of societies, medical societies, Endocrinology Society, the OH, the PCP, the PSN, the PFP, which I am affiliated with. Okay, I am a diplomat and regular member, also PCOM, and syempre, other reputable agencies, di ba? So, importante na pag-usapan natin ito. Because we see patients like this a lot. If you are patient that is categorized as obese, and then you were screened, kasi syempre, obesity is a predisposing factor for diabetes and hypertension. Nung na-screen ka, pre-diabetic ka, anong tanong? Ano yung primary goal natin in treatment? Or how do we treat patients who are obese and are pre-diabetic? That's a good question kasi I heard this today. Yes. Kasi we often encounter these types of patients. And importante, kapag may mga ganitong sitwasyon, we provide ample treatment. The cornerstone again is still lifestyle modification. You have to provide an equally important assessment of your diet and provide ample physical activity recommendations and prescription for the patient para makapag-provide ka ng lifestyle modification. Aside from that, as part of lifestyle medicine, you look at other areas, stress management, wellness, proper sleep, na dapat tulog na ako sa oras na to, avoidance of risky substances, okay? And then yung dalawa, physical activity and nutrition, diba? Now, what if lifestyle modification fails? So, dyan papasok ang question na, how about if these are patients who are categorized na obese, mabigat, may timbang, okay, and are pre-diabetic, and fail lifestyle modification. So what do we do? Okay, should we recommend providing medication? Bibigay ba tayo ng gamot? Yun yung tanong ko. So that is question number 2 sa recommendations. Should we recommend pharmacologic therapy? Okay, for patients who are adult and pre-diabetic. So I think pre-diabetic na lang, sabihin natin. Kahit di ka obese, pero ito naman, who are pre-diabetic. So the recommendations here is we recommend pharmacologic therapy among adults with pre-diabetes who do not respond with lifestyle modification. So that it only entails here na pwede na tayo mag-start ng gamot. Okay? Specifically nabanggit dito, you would be mentioning metformin as a medication for pre-diabetes. Okay? But may catch doon. If hindi, mag-work ang lifestyle modification. So your first line pa rin will always be providing the patient the proper prescription of lifestyle interventions. Papaguin mo yung diet niya, physical activity. Pero kung hindi niya kaya, saka ka mag-reseta ng metformin. Okay? Hindi agad-agad. Okay, bigyan mo siya ng chance. Kasi most of the patients na nakikita namin na pre-diabetic, hindi pa po nga palo ng 126, ganon, Sa 110, 111, ganun. Pre-diabetic pa rin, you have to do what? 75 gram OGTT to confirm pa rin na diabetic siya. You provide lifestyle modification. Since after 2 weeks ka pa magpa-OGTT, provide lifestyle modification. Tignan mo kung magkakaroon ba siya ng pagbabago or kaya ba niya mag-commit. Check mo kung may level of change or willingness siya magbago. Kung hindi talaga, then you could decide as a doctor to start medication for pre-diabetic patients. Okay? So, dapat nandun ka, dapat naka-tailor fit. Individualize mo yung pasyente. Kung sa tingin mo hindi siya magiging successful, okay, if you counsel the patient tapos tingin mo hindi niya kayang i-commit, mag-provide ng lifestyle change, you could start the patient with metformin. Now, recommendation 8, sabi niya dito, gano'ng kadami? Ang dosage kasi ni metformin can be up to 2 grams, diba? Or let's say 1 gram twice a day. Yan. Depende kung ano yung mga nireseta ng mga doctors nyo. You could comment it down below kung ano. Tignan natin magkakaiba. Pero normally, it should be within the allowable levels. Pero sa metformin, it should be, especially for pre-diabetics, 0.5 to 1.7 grams a day. So 0.5, that's 500 milligrams a day. So that's 1 tablet of metformin once a day. Pwede ka rin mag-provide ng up to 1.7. So, at least, siguro pag ganun, 1.5 o 1.7. O yun, pwedeng 3 tableta pa. So, parang technically, pa nagbibigay ka na rin ng gamot for diabetes. No? Pero, if you go back, okay, you could start with always the lowest dose. Pero, it does not replace your lifestyle change. So, if you have the opportunity to change pa rin, yun pa rin ang pinakamahalagang gawin mo. While you're starting the patient on lifestyle prevention, dapat nakaschedule ka ng mag-undergo ng 75 gram OGTT or reassessment for your sugar. Okay? So, aside from that, yun din, you have to do reassessment of 75 gram OGTT. I think the preferable time is at least after 2 weeks after ka nagpa-test ng blood. Or you could do an HbA1c. Okay? If you do the HbA1c, you monitor it every 6 months. Okay? Pero pinakamahalaga pa rin dyan is you have to educate the patient correctly. Kasi kung sinabi mo, nagbigay ka lang ng reseta, wala nang ibang interventions, you did not provide them proper counseling, maliligaw yung pasyente. Hindi niya alam kung ano yung susunod niyang gagawin, ano yung susunod niyang hakbang. Baka hindi nyo pa nabanggit kung kailan ang follow-up niya. Okay? Don't forget the patient. Don't forget that the patient should always follow up with your management. Kasi, kawawa naman siya kung let's say, iniwan mo na siya sa ere kapag di mo na pina-follow up. And it's important that they be monitored correctly so that hindi siya mag-turn over to full-blown type 2 diabetes. Kasi pre-diabetic pa siya. It can still be reversed very easily, just as long as they follow the correct guidance from your doctor and the proper protocol treatment. Okay? Wala akong binanggit dito na anything na supplement at all, just as long as you follow the guidelines and also follow the advice of your doctor. That is, okay, clinically sound. So, hopefully, naintindihan nyo to. You can provide medication na for pre-diabetes. That depends also with your perspective on management of lifestyle. So, you could move around with this recommendation. Recommendation 7 to recommendation 9. Now, nabanggit niya rin dito, you could use other medications, especially kung hindi nila matotolerate yung metformin. So, other medications na nabanggit is an SGLT2, either empagliflozin, dapagliflozin. Okay, you could use them also as a medication for pre-diabetes. Si EMPA, I think it has 10 milligrams, the lowest dose. You could also use that. Okay? Pero again, the hallmark here is lifestyle change, then support it with medication. So, I hope you find this interesting, specifically sa mga primary care doctors na makikinig dito or even to patients. Again, for patients, huwag kayo magsa-start any medication without proper prescription, magpatingin pa rin sa doktor. Again, if you feel that this video is entertaining, amusing, and suits you, feel free to drop a comment, like the video, and also, syempre, subscribe. And again, this is Doc Chris, your online family doctor, making medicine easy for you to have a healthy life. Good day.